Good morning to you all, and Chairman Dr. Ajit Babu, Lalit, Nitin. I think this is the fourth consecutive year that Dr. Ajit Babu is having this particular course in the All India Ophthalmological Society. And what is quite surprising is that even after 4 years, this particular course is attracting so many delegates. And it only shows that still there is so much of interest in this particular subspecialty, that is medical retina. For a good angiogram, you need a very there are basically few essentials when we do a fluorescein angiogram. I think in most institutions, including mine, fluorescein angiography is done by technicians or optometrists or ophthalmic technicians. In very few centers or probably individual practitioners, the doctor himself does the fluorescein angiography. So what we need is a cooperative patient. And for a cooperative patient, I think any patient who comes for any investigative procedure, especially an invasive investigative procedure, is anxious. I mean, when you say you have to inject a dye and take pictures, and when he hears the word angiogram, he suddenly thinks, oh, something like coronary angiogram, I've got to undergo a particular invasive investigative procedure. So it's very important to educate the patient about what exactly he is going to do, and you need to do something like a mock drill or a dry run. That is, just explain to him that you've got to keep your chin on the machine and I'm going to click with the flash, otherwise suddenly you pull the patient, put him on a chair, put him on the chin rest, and then suddenly a nurse comes and injects a dye, so the anxiety element increases, the cooperation just disappears. So you need a cooperative patient, you need to educate the patient, you need a good dilated pupil, although you have now fundus cameras where you can take very good pictures with small pupil, even with the normal pupillary size, but it is ideal to have a dilated pupil, and you need a clear media, and you need a trained photographer, and most importantly you need a good machine. That's very, very important. And as they said, most machines are the same, but maintenance is very, very important, because this is purely an optical machine. It's got a lot of lenses, and you need to clean the lenses properly, very regularly, so that it remains very functional for many years. You would have seen, many of you who are doing fluorescein angiography, you would have seen after the first year itself you see these marks on an angiogram or in the color photograph. That's basically because of the debris or fungus that collects from the lenses. So there are a variety of mydriatic and non-mydriatic fundus cameras available with manual and automatic shooting options. We are using the Zeiss 450 Plus manually controlled operation for many years now, and we keep using the same machine. So basically the fundus camera has got various parts. One is the joystick. The joystick helps to move the camera just like a slit lamp. It helps to move the camera back and forth. It helps to focus the fundus and also move sideways, and it has got the camera trigger. And you got the field adjustment knob. That is, you got a 20, 30 or a 50. Some cameras have only a 30 and 50, and this particular camera has got a 20, 30 and 50 degree field adjustment knob. So we also have the swing and tilt mechanism. In manually operated machines, you have the swing and tilt mechanism, whereby you can tilt the particular machine both vertically and sideways. And with this, you can see, you can photograph the periphery of the fundus. Today, most patients, we are doing fluorescein angiography for macular lesions. But when you want to do a fluorescein angiography for peripheral lesions, like in certain patients with diabetic retinopathy, where we want to understand the perfusion of the retina, or certain inflammatory diseases of the retina, where we need to take pictures of the peripheral retina, you need to move the camera to the sideways and also above and below. So the video monitor is very good. If you have an attached video monitor, it makes it very easy, because you don't have to use your eye and look through an eyepiece with one eye to focus the retina. And this is definitely necessary for purposes of indocyanine green angiography. There are very, very important areas where we need to focus on when we are doing a fundus fluorescein angiography. The one is the illumination lamp and the intensity control. Lower intensity levels minimizes photophobia and blepharospasm, and poor visibility may necessitate brighter illumination. That is, if you have an early cataract or a mild corneal opacity, or you're trying to do a fluorescein angiography in a patient who's got a mild vitreous hemorrhage, then you need to increase the illumination. And evenness of the illumination of the fundus cues the photographer as to how evenly the fundus will be illuminated as a flash during actual photographing. and make camera position adjustments to ensure an uniformly illuminated photograph. I will come to that later. So the camera lens must be free of dirt. Before you do the fluorescein angiography, it's very, very important to check whether your machine is in order and the lens is free of dust, and especially finger marks. What happens is sometimes when you do a fluorescein angiography, the tear film sprinkles on this lens, and once the tear film sprinkles on the lens, you get these artifacts in your pictures. You should therefore, after each fluorescein angiography, you must check whether the lens is clear. This is very, very important because the tear film can form a debris or droplets on the surface of the lens. The machine height must be adjusted to comfortable levels. Now you can see in this particular photograph how a patient is seated, and it's very, very important here. The patient is seated here, is erect here, and I always advise to use a chair, not a stool, because a patient has a vasovagal or anything like that, the patient just falls down. If he has a chair, he can just rest back, he can relax. And then the patient should be seated erect like this. There should be a gap here, the eyebrow and the forehead, there should be a little bit of gap so that the eye comes perfectly in the center here. Therefore, it's very, very important to position the patient very, very, very well, especially when you want to do this particular investigative procedure. Therefore, inform the patient that the bright flash is harmless. As I told you earlier, you need to educate the patient because the flash is definitely very difficult to tolerate at times. And the assistant will have to hold the eyelids, especially in deep set eyes. The patient is having a deep set eye in a deep socket. It's necessary because the palpebral aperture is very small and it may be difficult for you to take the photography, and therefore you will have to hold the upper and lower lid and have a small tissue here so that the tear droplets are taken care of. And more importantly, when you want to do peripheral photography also, you need to have an assistant pulling the upper and lower lids like this. Encourage the patient to blink between shooting. This is very important. Otherwise, the surface of the cornea is dry and your pictures are not good. Therefore, blinking keeps the cornea moist and clear, and blinking also removes excessive tears. And the assistant must be ready with a tissue paper to wipe away excess tears. This helps prevent tear droplets falling onto the camera lens, and it must be photographer who instructs the patient to look in a required direction. This again is very, very important because he is a person who knows what exactly he is doing. Therefore, angiography begins after obtaining color and red-free photographs. The timer started at the exact moment of the dye injection, and the pushing of a bolus may cause, ideally you need to push it fast, but then you don't have to push it very fast. It shouldn't be too slow and it shouldn't be too fast. The photography begins with the posterior pole. You start shooting within a seconds after injection of the dye, and this helps the patient to adjust to the bright flash. This is very important. You take one or two pictures so the patient gets comfortable before you actually do the angiographic examination. And then this allows you also to adjust the intensity, because the light intensity required varies from patient to patient. So for the initial photographs can be used to adjust the light intensity and the uniformity of the pictures. So you can see here you have one hand on the joystick and the other on the camera, and simultaneously you work, and the camera must be constantly adjusted to obtain the required field using the swing and tilt mechanism. You can see here the tilt mechanism that is being used to take the pictures of the peripheral retina. So the camera must be optically centered and close enough. You can see here if there is an improper centration, this is the sort of picture that you get where the central portion is reasonably okay, and the peripheral you get this shadow, and the camera is too far. This is what happens, and this is a good photograph. Therefore, you need it centered properly, and also you need to focus properly. Both are important, and you must know what exactly to do when you have a particular problem. This also is very, very important. Suppose you get a picture like this, you must understand that the camera is too far. You must come closer and take the picture or photography. All this comes with experience. So the photography is either with a 50 or 33, and the macula should be photographed using the arterial phase to highlight the fluorescein, the foveal avascular zone. The poor dye concentration during early phase and poor media clarity may obscure the foveal avascular zone and may require overexposing the macula. The photographer therefore must increase the flash intensity step by step until he gets the correct exposure. Increasing the flash intensity may overexpose the disc, especially if there is a capillary. This is very, very important again. Flash intensity must be reduced while photographing the disc, because increased photography may cause overexposure, and wide variations in flash levels may result in misinterpretation of angiogram. This again is very important. What we call as blooming, and this is what is blooming. You can see the amount of blooming. Actually, this is the picture that you have got. This is actually the correct picture. Therefore, there will be misinterpretation of the fluorescein angiogram in such situations. Shooting the periphery, the patient must be instructed to look in the direction to be photographed, and you must use the swing and tilt mechanism, and the flash intensity may have to be increased a little bit when you're doing the this again is very important, because when you're doing the peripheral pictures, you need to increase the flash intensity a little bit. Therefore, when you have corneal opacities, especially small corneal opacities, don't affect, but then you can, corneal reflection is not a problem with modern devices, but then when you have a corneal opacity, you can focus the cornea. Small pupil, again, you've got now non-mydriatic cameras which are good, but if you have a camera which is not non-mydriatic, again it will be slightly difficult for you to do fluorescein angiography, but you can manage the posterior pole in most of the cases. Cataract again makes it difficult, but again you can shoot through the clear area of the lens. You can see here there is a central opacity, and by shooting through a particular point through which you could see better, you can get good pictures. So it's not always necessary that in patients with early cataract you can't do a fluorescein angiogram. Vitreous hemorrhage also, as I told you, may make it very difficult. Reflections from the intraocular lens also may be troublesome. The camera position may be adjusted for least reflection. Digital processing has made the image processing software. Here you can see how you can process the image after the fluorescein angiogram to improve your interpretation of the fluorescein angiogram, and this is possible today with the digital imaging with all the softwares that we have. And lastly, the automated imaging, the infrared illumination for patient comfort, and automatic flash adjustment, and all these things have made the process of fluorescein angiography much easier. And therefore, in summary, to do a good fluorescein angiogram, you need a good cooperative patient, ideally a good pupillary dilatation, a clear media, good camera and a trained photographer, and a good understanding of what exactly is a normal fluorescein angiogram. Thank you.